This is Archangel. It is an endotracheal tube holder that can also secure a feeding and a gastric suction tube, as well as an EDI catheter, all without tape. There are 3 openings on the top and 3 openings on the bottom. The midline is for the endotracheal tube. One side of openings will be for gastric suction tubes, and the other side will be for feeding or EDI catheters. Any of the tubes can be inserted and secured into the patient nasally, orally, or a combination of the two. There are also raised ridges on the top of the arc, which identify what size tube goes into which opening. The selection of the Archangel is based on the ET tube size, so we can accommodate between a 2.5 and a 4. They are color coded, so their outer rings are color coded here. And I do offer 2 arc sizes for the 3.0 ET tube. I felt that there could be babies that were 800 grams or maybe up to 3 kilos that were intubated with the 3.0. So that just gives you a bigger variety to customize it for your patient. Okay. Also, the cheek pads come in 2 sizes. We have a smaller and a large. This is the smaller size, and this is the larger size. The cheek pads themselves are silicone, and they have an oversized acrylic adhesive underneath. So the silicone is waterproof. So if the baby has any emesis or blood or saliva that drips out of their mouth and gets onto the pad, that can be wiped clean with a wet washcloth or a saline wipe or a baby wipe. And then this outer overhang here, you'll notice that there's a 5 millimeter overhang on the adhesive. That's a very important and intentional design feature. That overhang will allow the skin's heat to escape under the adhesive, actually letting the adhesive stay in place and do its job. So we've been having a very consistent wear time of about 14 days with these pads, even on infants with high heat and humidity. A couple important things about the cheek pads is that you do not want to trim that overhang on. It's okay if a little bit of the adhesive gets on the baby's scalp or the ear or the hair. You would rather have the adhesive in place than to trim it off, because the more you trim off, you're going to be decreasing your wear time. Also, there's no skin prep required for this product. So any kind of a skin prep should not be used, like Mastisol or a Cavalon skin barrier. The adhesives will fight the chemicals in that barrier, and you'll decrease your wear time significantly. So the recommendation is just to be placing these cheek pads directly onto clean, dry skin. So when you get your arc, you will also get a set of cheek pads. The arc has raised ridges on the arms here, and then there's a barb here at the end. So that barbed end is going to feed through the cheek pad channel, one on either side. So once the cheek pads are placed on the device, you have about a centimeter of adjustability on either side to really customize the fit for your patient. So you can really customize the fit. You want the arc to be as close to the baby's cheeks as possible without putting any pressure on them. Okay. So the application of the arc onto the face is very simple. I recommend the person placing the device should be at the head of the bed. That will just give you the best, most symmetrical view of the baby's face, because once these pads are stuck down, they're gonna remain in place. You're not gonna be able to lift them up and readjust them. So you're gonna want to get a good placement the first time because of that nice, good long wear time. You just want to make sure that you have a good position. So you're always going to intubate your baby first, and then you are going to apply your arc with the cheek pads intact. So I always recommend, once the baby is intubated and stable, you're bagging the baby, he has a nice heart rate, oxygen levels are great. You're going to want to take 10 or 15 seconds before you actually apply this to the baby's face to kind of pre-adjust your cheek pads so you know where you want to go. Okay. So I like to lay it down on the baby's face with the liner still attached. And you want to make sure, again, that the cheek pads are as far back to the baby's ear as possible. And you want this arc right over the baby's upper lip. You want that arc to be right over the baby's lip. That's going to allow the ET tube to sit nice and midline in the mouth without putting pressure on the palate. Okay. So once you feel that you're pre-adjusted well and you like the way this looks on the baby's face, then you can go ahead with your application. There's no prep required for these pads. They do not need to be warmed up. You can simply release the liner and stick them down on the face. So to remove the liner, I recommend folding the cheek pad in half. It's a split liner, so it will split down the middle. And this is important. You want to do it this way because you will avoid having that overhang kind of flip back on itself. So you're going to remove the adhesive on both cheek pads. And then you're going to apply your arc to the baby's face. Okay. When you go to apply it, you want to hold the cheek pads from the very, very edges. And you want to flare them out before you sit them down on the baby's face. So we know where we're going to go. We're going to flare these out and we're going to set them right down on the baby's cheeks, making sure that you push all of that nice adhesive down to get a nice good seal. Okay, the cheek pads are very thin and very conformable, so they will really hug the contours of the baby's face. So once your cheek pads are down in place, now you're ready to insert your tubes into the device. So I'm going to move this around. Once the baby is intubated, you're going to insert the tube into the device. So this outer ring can open all around. We're going to open up this ring now to the midline hole on the bottom. That's going to be for our endotracheal tube. To get the tube into the device, you need to, I like to hold it with one hand. I like to hold the arc with my one hand. I'm going to put my thumb on the back tab here of this outer ring, and I'm only going to use one finger. I'm going to pop my ET tube in from the bottom. You kind of have to go from up and under, and you'll continue to walk your tube up into the device, and then you're going to turn and lock your tube. So now my ET tube is locked into place. If I need to add a second tube, a feeding or a gastric suction tube, again, you can place it nasally or orally, whichever you prefer. If you do place it nasally, you would just want to be mindful of what side that feeding tube opening is on. Okay, I'm going to place this baby's tube orally. So once I have it in my patient, I'm going to secure my feeding tube. So again, I'm going to open up my ring to my feeding tube opening. Now I can move this ring all around and my ET tube is still going to stay secure. I can even open this ring up all the way to my ET tube and it's going to stay secure. Once it's popped into the device, the tube is secure. This outer ring is just a secondary locking mechanism. So now the same thing with my feeding tube. I'm going to place it in from the bottom of the opening, feed it up into that groove, and then turn and lock that as well. So now my feeding tube is also locked into place. Everybody has a very nice visualization of where exactly the tubes are. You can suction really well. You can provide oral care. Again, if the baby has any emesis or blood or saliva, you can wipe them, the cheek pads clean without having to replace them because they get soiled. Okay. If the baby needs an adjustment made on any of their tubes, it's really simple and it just takes a couple seconds. So if you need to make an adjustment, you're going to open up the ring to the tube that you need to adjust. Okay. So if we're going to adjust our ET tube, again, it's locked in the device. It's not going to fall out. We're going to open up our ring to our ET tube. Okay. We're going to find a letter or a number or some kind of landmark on the ET tube in this area here. These outer hash marks here on this outer ring, these are 1/4 centimeter. So you're going to use these now as your measuring guide to make your adjustments. So I'm going to find a letter or a number on my ET tube within this area, and I'm going to line that up with one of these predetermined hash marks here. If you can't see a good letter or a number, all tubes are marked differently. You can take a pen or a marker and just make a dot on your tube and then use that dot as your guide to make your adjustments. Very important, when your ET tube is locked in the device, it's never going to come out until the baby comes off the ventilator. So we're going to do all of our adjustments with it locked in just like this. So if I need to make an adjustment, I'm going to hold my arc. I'm going to either retract my tube 1/4 centimeter or 1/2 centimeter, whatever my patient needs, or I can advance it 1/4 centimeter, 1/2 centimeter, again, whatever my patient needs, and then turn and lock it. So it's very safe, very precise adjustments, and the best part is it just takes one person. Same thing with my feeding tube. If I need to adjust my feeding tube, I'm going to open up my feeding tube, make my slight adjustment, and then turn and lock it. I always want my outer ring little tab here to come in contact with this raised part of my arc. When those two come together, I know that all 6 of my openings are locked off. So we always want those to be together. If my baby is ready to come off the ventilator, okay, you never need to pull the adhesive off this baby's face in an emergency or in any situation. It can always be removed in a controlled setting. So if the baby is ready to come off the ventilator, if you want to salvage your feeding tube, you can. You can just pull it off and lay it to the side. We're going to hold our cheek pads in place and we're going to extubate our baby, okay? So now our baby's face is clear. If we need to give PPV to the baby or you want to put them on high flow or CPAP, you can do all of that and you're going to leave the cheek pads intact. The reason is that we know sometimes the babies look good initially and maybe they need to be reintubated in 6 or 12 hours. If that's the case and the baby needs to be reintubated, you can keep your ARC at the bedside per your hospital infection control policy, and you can intubate and put it right back in. So as long as the baby is intubated with the same size ET tube, you can continue to use the same ARC on the same patient. However, if this baby, let's say you wanted to upsize this ET tube and you wanted to, give them the next size, you can just grab the next size ARC that coincides with the new ET tube that you're going to be using. Your pads are already on the patient's face and they're already intact. So you can just intubate and slide that new ET tube holder, your new ArcAngel, right back in. Another really nice feature of the ArcAngel is that, like we talked about at the beginning, you do have about 1 centimeter of adjustability on either side to really customize it for your baby. So if he has molding, or maybe the baby's getting edematous, maybe he's septic, or the cheeks are just filling out because the patient is growing. If your ARC starts to get tight on the baby's cheeks, you have the ability to adjust the ARC within the ArcAngel itself to provide more space for the baby's face, okay? So not only are these hash marks here 1/4 centimeter, but the raised ridges on the arms of your ArcAngel, those are also 1/4 centimeter, okay? So if your baby is getting edematous and your baby's ARC is getting tight on their cheeks, you can remove several different hash marks up. You can lift this up out of the cheek pads to give that baby some more room. However, this is going to come up and down as a unit. So if you pull your ARC up and out of the cheek pads, your ET tube is going to go with it. So prior to doing that, you're going to want to pre-advance your tube maybe 1/2 centimeter to give yourself some space. Then make your adjustment here. Your ET tube is going to come right back up with it. Go back and double check your tube to make sure that it's still in a good spot. Maybe you need to make one more little adjustment and then turn and lock it back up. Now on the flip side, maybe the baby's edema is resolving and you want to push this back in, because remember the ARC should be as close to the baby's cheeks as possible. So if you wanted to push it back in, your ET tube will be slightly deep just for a few seconds. Get it to where you like it, and then you can make your minor adjustment on the tube after you're happy with your ARC position. Another addition to the ArcAngel that we have come out with is the addition of our adhesive strips. So with every ArcAngel, you will receive your actual ARC, you'll receive a set of cheek pads packaged like this, and you will also receive this little envelope in your box as well. These are our adhesive strips. They come in a set of 2 adhesive strips, and they are pre-cut. These have been tested with the heat and humidity to withstand that, okay? The reason for the adhesive strips, we have a couple uses for them. One, all ET2 brands are made with different materials. Some are silicone, some are polypropylene. The silicone-based endotracheal tubes tend to get very soft and weak when they're exposed to the heat and humidity. And over time, they do not like to grip inside the ArcAngel as well as a polypropylene tube. So we have found that when you take one of the adhesive strips and you candy cane it around your ET tube prior to placing your ET tube into the device, that extra piece of adhesive on the tube kind of serves 3 purposes. One, it helps to strengthen the ET tube in this area. 2, it provides a little bit of a physical grip on the outside of the tube to better grip the inside of the device. And 3, it adds an extra 0.11 millimeters of outer diameter to that tube to kind of give it a little bit more grip inside the device. So again, this is typically used with silicone-based endotracheal tubes such as Portex and Vigon. And that would be the indication for using it on the endotracheal tube. In our testing and in our lab work, we have discovered that the addition of this adhesive strip has increased the pull force strength on those tubes by 70%. So it really does help the strength of the ET tube and how it performs with Archangel. Another indication for using these tubes, or I'm sorry, using these adhesive strips is that if your patient has, let's say, a need for a gastric suction tube that is a different size than what is offered with the Archangel that the patient is utilizing. Maybe you have a very small baby and he needs a 10 French gastric suction tube, okay? You can also use these adhesive strips to secure an alternate size feeding tube, gastric suction tube, or EDI catheter, and I will show you how to do that. Because I want to eliminate tape on the face, and again, we have tested these strips in the heat and humidity, and we have a lot of customers using them this way. You can take the pre-cut adhesive strip. You can secure your alternate size tube that you need. We're going to chevron this adhesive strip around our alternate size tube, and we're going to go ahead and tape it right to the underside of that arc. Okay. We've tested this again with the heat and humidity. It withstands beautifully, and we can keep the adhesive off of the baby's face and still have a nice secure tube. So this would be another indication for the use of these adhesive strips. Now in this application, you could use any other kind of bedside tape you have, whether it was silk tape or cloth tape, you could use that. We know that these are very easy to use. They're pre-cut, and we've tested them with the heat and humidity, and they hold up beautifully. So that is all of Archangel. For more information, please visit warriornp.com. Thank you.